Welcome to another edition of What's Next? Living Longer, Better, Smarter. This episode is made possible by VitalTech, providing digital solutions transforming connected health. For more, visit vitaltech.com. I'm Fred Fishkin along with Mary Furlong. In this episode, we have some very knowledgeable guests joining us to talk about telemedicine today, what you should know. From Doctor on Demand, Vice President of Medical Affairs, Dr. Prentice Taylor. Thanks for being with us, Dr. Taylor.
Yes, happy to be here. Thank you.
Grant Chamberlain is Managing Director in the Corporate Finance and Healthcare practice at Ziegler. He has over 20 years of investment banking experience and much of his career focused on virtual health. Great to have you here as well, Grant.
Thank you for joining.
And Ernie Iannacci joins us from VitalTech, a company providing digital solutions for connected health. Thanks for taking part, Ernie.
Thanks for having me.
Well, we sure have a lot of expertise here. Mary, maybe you want to kick things off.
Yes, I'm going to turn it over to Grant Chamberlain. And Grant, I'm such a fan of your work. And can you tell us a little bit about how busy you've been and what are the trends that you're seeing?
Yeah, as you know, so my focus is in M&A and capital raising in the virtual health and digital health space. And we've seen more progress in the last 5 months than we've probably seen in the last 5 years. I think, I saw a stat from Sutter in which they did 70,000 virtual studies in 2019 and are doing 70,000 a week now, 50 times increase. And that was several weeks ago. And so we're to me, this is really about brute force awareness in the marketplace of tools and technologies that I think have been building for the last 20 years. And the beauty of where we are now is a lot of the tools, technologies have advanced to a point where it really is about ease of use and ease of entry and the utility of these tools. And we're now seeing, a recognition that players and where capital is flowing in is companies that really understand that integral marriage between social determinants, behavioral health, and chronic care management. And as we see the tools and technologies work towards, creating that digital front door in which it is an easy button to get in, and it is embedded directly in the workflows of the current provider base. And probably the most important aspect is how do we navigate to the right level of licensure? Because in my mind, telehealth and digital health really is a means to optimize workforce. How do you ensure that everybody in the workforce stream, whether it's specialist, primary care physician, nurse practitioner, licensed social worker, family member, are all engaged in operating at the top of their licensure or in utilizing those tools? And we're seeing huge momentum in two areas. Think about where we've seen even pre-COVID, but now part of COVID, an enormous amount of momentum is in the behavioral space. Telebehavioral is exploding for a lot of reasons, and is taken off even more so now within the COVID dynamics. And in some degree, I'm a board member at the American Telemedicine Association, and for a long time we promote that virtual care and telehealth is as good as in person. In some aspects, telebehavioral may well be one area that may well end up being demonstrated to be better than. If you're able to engage with somebody and absorb their social determinants around them, you're delivering a better. And then, Mary, the other area that we're seeing enormous growth is where you focus your attention is in these smart aging senior living space. We're now, we're probably in the 5th or 6th inning in the evolution of telehealth broadly. In the senior living space, we're probably in the second inning, but growing rapidly across so many different use cases that are now, driving into the sector because of, what were the realities of COVID. So that's a long answer to your question, Mary, but I think we're seeing an enormous amount of momentum across the board and a lot of activity, M&A activity as you're seeing in the marketplace, whether it is, public IPOs, an enormous amount of capital flowing into the space, and a lot of M&A because the space needs some players of scale, and the players we have on this line or on the call with us are some of the leaders in this sector as well.
Dr. Taylor, you've got the coat on, so I'm thinking I got to ask you to look at my shoulder here, but tell us a bit about Doctor on Demand, a little background.
Well, Doctor on Demand is one of the largest of the national telemedicine companies. We like to say that telemedicine really is just another way of doing medical care. In our experience, it's appropriate for 92 to 95% of the situations that people would normally call a doctor for. There are a few things like trauma, for instance, where it's not as great for, but increasingly it's showing the value that it adds in primary care as well as traditionally urgent care, and growing, as was pointed out by Mr. Chamberlain, in terms of behavioral health. So we are a company that was started with some initial funding from Google Ventures and Andreessen Horowitz, and since then have had a lot of experience with partnering with a lot of organizations such as Walmart and a lot of the national health plans. So what we are, I think, most proud of is that we have been able to, in terms of the senior segment, not only serve Medicare Advantage health plans, but pioneering in Medicare Part B, and have been very involved with caregiver stress programs and getting the social determinants of health screened for in depression screening. So I guess I don't want to be too long-winded about that, but any questions you want to ask me, I'm happy to unpack for you.
Well, one of the things, my impression has been, I suppose, that early adapters would look at this field and say, sure, let me go online. But seniors might take a lot more convincing. Is that right?
Well, I would say that our experience with seniors is that they fall into different segments. Certainly baby boomers have proven. I was just working with McKinsey last week, and they did a recent survey showing that 74 to 78% of baby boomers are very comfortable with digital technologies and are eager to do more with telemedicine. They are the more frail elderly who need assistance. But we often mention the anecdote that the oldest patient who's called in totally independently to use us was a 94-year-old man, which surprised us. But there are many seniors who have a lot of interest in this space. And we have a number of programs which, working with various health plan and other partners, are focused on their needs, like in fall prevention, for instance, and assessing the home environment, making sure that they're on the right medications and not too many medications, and so on and so forth.
Ernie, let me bring you in. This can be more than just a Zoom type of call like we're on now. What kinds of technologies can be employed here to really help with patient monitoring and telemedicine?
Well, you know, that's really interesting. Telemedicine is kind of a catch-all. At VitalTech, we actually look at telemedicine as a subset of virtual care. And virtual care is really what we see as truly an exploding field. And that's really what we do. We provide a virtual care platform. So whether it's remote patient monitoring, it's the digital front door that Grant pointed out, it's delivering a telemedicine session or population health. It's really all about delivering virtual care in all modalities wherever the patient needs to be served. So it's, delivering care to an aging in place senior, or maybe a shut-in senior, or even to, a mother that's working, constantly and has a sick child. So it's really across the spectrum. And it's more than just hooking up a doctor or a caregiver to that patient. It's bringing back vitals. It's bringing back social determinants of health. It's bringing back activities of daily living, contextualizing all that information, providing the care team with actually richer data than they got in the old world, where they just got to visit once or twice a year and 15 minutes with their care team, and that's it. Now you get that really rich contextualized data. And I agree, there's certain disease states, certain conditions, behavioral health being one of them, but long-term chronic care, where you might actually get better care in this new world order than you were getting before, because of all that trend data and that in-between visit information that you lost and never could capture.
Grant, what's big here? Wearables, robots, and things like that to enable a lot of this?
To me is one the beauty of what these two gentlemen have is they really are about workflows. This is about analytically driven workflows based upon evidence. And how do you create those tools and technologies that create those flows so that ease of entry and the utility of those tools is exploited and used optimally. And I'm with Ernie. I honestly believe over time, as more technology, because there's AI and 5G is going to transform this space continually. As you're bringing tools and technology and making things as simple as facial recognition to prompt the physician to repeat what he said because the patient didn't understand what you said. That's a wonderful piece of elegant technology. Having language that interpretation right alongside, having labs, imaging, and EMR and other data right in the view of the physician as he's going through it and prompting evidence as it's going along. It is really the marriage of all that analytically driven engagement in front of the patient, in front of the physician, and then honestly back to understanding their social determinants, but then it's really the basic blocking and tackling of people making their appointments. I mean, 40% of, some stats, we see 40% of behavioral patients don't miss their appointments. If you can drive better adherence to making your visits and better adherence and compliance of just taking your meds, we've gone a long way. And I really do believe that these tools and technologies and the individuals that are on this call really do drive better access and better compliance. And if you marry that with evidence, you really have, the perfect storm.
It's been the most stressful time for people, whether they're a small business owner or they can't see their families, or it's hard to get out. In California, we're having another spate of bad air this weekend, so that's a risk factor for people. Do you feel like this has been a revolution? This has caused a revolution in telehealth, the COVID, because people had to adapt so quickly in senior housing. And what is the scale by which it grew? The adoption curve.
Well, I'll take that first. I would say that, we often use baseball and other analogies that I would say that prior to COVID, we were about in the second inning of the adoption of telehealth, at least in the United States. And I think now we're probably kicked forward to the fourth. There's still a long runway to mix metaphors, but I think what it did is it showed a lot of people the value and the intimacy of telehealth and the connection of talking with an empathetic clinician face to face with these technologies and how well it works. So that's what I'd say briefly.
Dr. Taylor, 30 years ago when I started SeniorNet, the first question when we had a doctor online was, why don't the doctors listen to me when I go into their office? Because sometimes seniors will have a faint voice and they may have trouble articulating. And sometimes men have trouble saying, don't want to go to the doctor, and it's the wife or a daughter that encourages them. Do you think people listen better in telehealth? Because you seem so approachable to Fred wants to share his aches and pains, and I'm inclined too. It seems in some way there's an intimacy and a friendliness about it. At least it seems to me.
Well, briefly, the technology does aid that, but I know for us, some of it comes down to being very selective about choosing doctors to work for us who audition in video.
Oh, wow. Yeah.
And they are chosen for their eye contact, their empathy, their ability to pause and listen, etc. But you actually brush up against another point. So the electronic medical record era, a lot of thought leaders have pointed out, have produced a situation where you go in to see the doctor in the physical office and the doctor's over here looking at the screen and talking to you over their shoulder, but mainly looking at that screen rather than really interpreting all the nuances and subtle things that you're trying to express. Non-verbally as well as verbally. But I'll let others chime in.
What about patient? Let me ask you about patient load, Dr. Taylor, how that works. I know when, we all know the situation when we go to see a doctor in the office setting. how crammed are doctors who are participating in this today? What does this mean for their lives and lifestyles?
Well, we find doctors are attracted to this because they don't have to put up with the headaches of commuting time. I used to work for Advocate Healthcare, one of the largest healthcare systems in the Midwest. I drove an hour and 15 minutes to the clinic each way every day, and I'm glad I did. I was glad to be able to be of service. But the point I'm getting at is a lot of doctors are very attracted to be able to do this like I'm doing now from a home office, with their degrees behind them, and there's no commuting time, there's no windshield time, there's no variability with the weather. So it ends up making doctors, for many reasons, the software mainly, more productive than they would be otherwise. And there's less waiting time for patients. You're not sitting in a waiting room with a bunch of sick people with a doctor who's running behind, and the doctor will see you now. We all have had that experience.
So Ernie, talk a little bit about how your business was in January and then what happened in February and March, because you saw a big change.
Massive growth. We were mostly focused on senior living and the individual physician practices, physician groups. But one of the things that was a sea change starting in late February, early March was the large health systems pivoted sharply and embraced virtual care. Their decision cycles were compressed from 2 years to 2 months. I talk to hospital CIOs and CEOs every single day now. And they said, literally our 5 to 7 year plans were compressed to 5 to 7 month plans. And they're doing things that they just envisioned literally that, would be 2, 3, 4 years out now, putting them into place as fast as they can to just adjust to the new reality. And, I think that's a great thing for patients. It's a great thing for staff burnout. It's a great thing for all their clinicians. And again, I really think that the new world is going to be good for everyone, but there's a lot to figure out. There's a lot of disparate systems. There's integrating with the EHRs. It's new workflows. It's new care modalities. So it's really, behooves companies like ours to help our health system customers, advocates for one. You said you left there, that they're one of our big customers. And one of our jobs is to help them figure all of this out and implement the right workflows to make it better for their clinicians and better for their patients. And I think that's, what we're good at. And one of the things that our platform is really designed to do, because, you don't want to just throw digital technology out there and hope it sticks. You really want to design it so that it makes everyone's life better. And I think if you do that, care gets dramatically better.
Talk a little bit about rural, because just like in schools, there is a digital divide. And later on, we're going to have a guest who's 99 and a half, and she's adapting to the new technology. But
one of the things
that get access, because some rural hospitals are closing. That's
one of the things that concerns me a lot. Rural health systems are collapsing or on the verge of collapse. We're actually submitting a letter to CMS tomorrow, and many of our peers are as well, which is really advocating to allow for companies like Dr. Taylor's to be able to initiate care to a patient that they've never seen in person. And we think that is utterly critical to continue that after the PHE period, because you've got these people out in rural areas of the country that just can't get to a doctor. They can't get to a health system easily. So they need to be able to, initiate a care plan with Dr. Taylor's company, and that needs to be their primary care provider going forward. They can't drive 100, 200, 300 miles when they have multiple comorbidities and, visit a doctor once so that then they can have a telehealth relationship going forward. So we're really hoping that Congress and CMS puts that into place permanently after this emergency period is over.
Well, our next big event is in Washington, and we'll look at that. But go ahead, Grant, because I bet you're on
again, I'm going to do a plug for the American Telemedicine Association and what Ann Johnson is doing with their initiative called Cement the Gains. They are working directly with HHS and the Hill to drive, all of the progress we've made, and we've been working, long before this to try, there was an enormous benefit of all the waivers that we got that sort of created this, tidal wave awareness and access. But we now have to delineate those that should stick, those that, whether it is, the hip relaxation that allowed Zoom and other things to come in, need to pull back, whether it's controlled substances. There's some areas that need it, but the vast majority of the tools that were brought by those waivers are going to benefit broadly, certainly in rural health. And those need to be, solidified long-term. And I think there's a lot of effort right now going on. And really, one of the big beneficiaries, both of rural health and honestly, distance learning is, the momentum of what's going on is essentially that broadband needs to become a fundamental right. Broadband has to become a fundamental right in this country. And, the benefit of the Department of Education, Department of Health saying, hey, we've got to figure out a way to ensure we don't have these gaps in these areas. If those two collide, and we create momentum of wiring this country so that we do have equality both into the most underserved population, because there's as much an issue on the south side of Chicago as there is in Montana, and that is not only broadband, but that is the access plans. How do you have enough access on your iPhone to facilitate this? So there are tools to facilitate getting access. That's really what this is all about. How do you create ease of entry and consistent access over time? And that's going to be part of the benefits of some aspects of what's come out of COVID, and again, just the brute force awareness of how valuable these tools are, both in as I said, distance learning and in healthcare.
That's really, really interesting, Grant. The idea that many are saying healthcare is a right, but without the broadband, this kind of healthcare can't happen.
Correct.
So, what about the issues that a lot of people would wonder about? What can this do? What can't it do? Obviously, you're not going to draw blood or check a prostate or anything like that through telemedicine. So office visits are needed in some cases. So when do we go online as opposed to going into the office? And what about some of the privacy concerns that people may have about this? Mm-hmm. I'd like each of you chime in here. Maybe you first, Dr. Taylor.
Well, I would say, first of all, not to correct you, but you might be surprised to know that the major companies, through partnerships with large organizations like LabCorp and Quest, we've been drawing blood for several years and interpreting those results. And in Doctor on Demand, we've been innovating. I think my colleague mentioned some of the imaging studies. I think both other panelists mentioned those. So we've been doing the imaging studies, can send people for mammograms, MRIs, and all of that. So I would say that currently we're very enabled in terms of that, and we're not the only ones, to be frank. So there's a lot that it can do, but as I mentioned, there are a few situations. You mentioned feeling on a prostate, a pap smear, someone who's fallen down the stairs and their knee is big as a toaster. Somebody like that truly needs to go to the emergency room. But part of the value that we impart is keeping people in the right place at the right time, seeing the right clinicians and getting the right people going to the emergency room and the right people going to urgent care, and then other people doing this type of thing.
How quickly could I see a doctor online if I have something that I'm not sure about?
Well, generally in 3 minutes, you can connect. Wow. 24 hours a day. And behavioral health, that's traditionally worked by appointment. So one of the advantages, I know in our experience, we are able to do behavioral health appointments with psychiatrists and psychologists within 7 days, and recently started doing some same-day access for behavioral health visits. In addition, not to toot our own horn, but we've trained our PCPs to recognize, score, and treat depression and anxiety, and that service is available 24 hours a day. So that is a kind of behavioral health service.
Grant, you mentioned behavioral health earlier. I was interested in what are the kind of buckets underneath behavioral health? I mean, what are the different areas? It seems to me like a lot of people are stressed and having trouble sleeping, but are you seeing high anxiety?
Yes. I mean, again, the interesting thing is, I know we've published 3 white papers on the sector, and the beauty of what's going on in this space is there's just an enormous amount of tools, technologies, and there's no sector that has more utilities and uses than behavioral health, because you have psychiatry, self-management, MAT therapy, pediatric anxieties, there's and substance abuse. There's different tools, technologies, and workflows across all of those. And in what's going on right now with COVID, whether it is anxiety, whether it is dealing with and managing substance abuse, and how do you create tools and technology. There's the great thing about the awareness that's going on now is, you can use licensed social workers and, as you said, primary care physicians to triage and manage a lot of this, so that everybody is operating at the top of their license. And there's no area that's probably more in need of that than it is in behavioral, because there is such a scarcity of resources, especially as you get into geriatrics or childhood education. You have to be navigating and managing the access to the, so that the parties are all absorbing this at the right moment. And that's where the technology and the tools can triage that so that it does arrive at the right body.
We will be linking to your white papers. One of the misconceptions I think people have about older adults is they're not learners. And in fact, they read and access a lot of information. So I know some of your papers have been more aimed at the investor sector, but I think I find I read every single one. And so if you have other resources that you'd recommend to our listening audience, we'd like to suggest those, because it's a new category for many people, and we're all learning the issues. And we will be in Washington at our summit with the regulators at the table. So as you bring up this broadband issue, I've been advocating for that for a long time, since I was in the Clinton administration working on those issues. So we will be talking about that digital divide and those reports as well. Ernie, what do you see ahead?
I definitely see the adoption of virtual care coming mainstream. Remote monitoring of vitals, of daily activities, things like that. One of the things that I hope to see, and again, it has to happen. I don't know how long it's going to take. And it goes a little bit to what Grant was saying about letting providers operate at the top of their licensure, is that we have to break down some of the barriers and the regulations about cross-state practicing, so that you can have lower level operators looking at, say, doing monitoring or lower level triage, so that the higher level licensures could deal with more serious or making the right calls and decisions, and letting the technology route the patients correctly. Because right now there's so many artificial barriers that our system has evolved over time and erected, that it's just really hard to implement a true virtual care system in our country. We could save hundreds of billions of dollars if we pulled those walls down and allow our medical system to operate with efficiencies. And just, you can't right now. I mean, if you want to have patients in California that you're trying to monitor in Nevada, but the doctors are, maybe, in Wyoming, for example, that's just really, really hard. And, there's ways around it, but you have to do some really creative things to make that happen. And that shouldn't be the case. If the specialist is in Wyoming and you have monitoring personnel in Nevada, and the patient is, needed in California, that should just be able to be done. And, we have to get there.
Ernie, what do you say to people who question security and privacy when it comes to doing all of this online?
We've solved many of those things in the financial sector and in other extremely sensitive sectors in our country, whether it's national security, again, or financial transactions. We can solve the security aspect through the use of technology, just like in other industries. And again, I think when it comes to at least most people, if it comes to getting the care you need from the specialist that's only available remotely, you're going to trade off taking that 1 in a million risk with getting the right level of care remotely 99 times out of 100. And I just think we need to give people that choice.
And Dr. Taylor, when it comes to insurance, Have the insurance companies come a long way on this, or what can you tell us?
Are you talking about insurance in terms of health insurance companies
Well,
paying for it?
getting my visits, my telemedicine visits covered, and from the doctor's perspective, how all this comes together too.
Yes, the health insurance companies have embraced this going back several years. So they've been very forefront on that. So I would say within the first year of our existence, we had to prove to, for example, United Healthcare and Humana that we are who we say we are, that the security is there, the quality is there, the access works quickly, the software works. So they've been on it for a long time. So they're doing some actually very innovative things in a number of arenas.
Grant, you sort of hinted at this before, but hardly a day goes by when I don't see a press release or a news story about another development in telehealth or telemedicine, something else coming along. How difficult is it for you to keep up with all of this?
It's impossible, but the beauty is, one, because of my role at the ATA and some of the other efforts on, and the fact that we are in the middle of a number of transactions, we're engaged with it, and part of our things that I've been promoting and driving for a long time, and I think virtual clinical trials and decentralized clinical trials is an area that, if you think about what's really driven, what's been a beneficiary of virtual, that historically was an afterthought, that I've been on a soapbox for years saying, why wouldn't we use virtual and telehealth to help manage and drive both adherence, compliance, and efforts in between visits using these tools, because it's just a more compassionate way to deal with it. Why make somebody get in a car to go visit a principal investigator that's 2 hours away on a trial that could be done virtually? And the pace of innovation that's taken place in the last 6 months in decentralized clinical trials, and the awareness of some of the biggest CROs and sponsors, as well as the growth of innovative companies at the grassroots of creating the secure infrastructure, because of you think it's complex to do tele on a regular HIPAA base. The complexity of delivering clinical trials on a secure, navigated solution because of what the pharma, FDA, and IRBs are required to do. But by definition, it is maybe to me one of the most obvious areas of how you should be dealing with and ensuring both a delivery of a trial more effectively. And the nice thing about it is the ROI is huge. If you can keep people on trials, if you can help them, become more conclusive, you can expand the catchment area because you're able to drive this, it is the right way to do it. And so those back to, things that I see that have been innovative and new technologies. I highlighted in my white paper pre-COVID because it's an area I've been pursuing and pushing, and it became one of the fastest growing areas of the impact of COVID is how do you keep people on trials, and how do you get them access to trials?
Well, what an interesting discussion, and so great to have all of you here. I guess if you had one piece of advice for a senior out there thinking about their future in health, what advice would you give them?
We'll let each of you take that one on. Dr. Taylor, you want to go first?
I would say for seniors out there that the AARP has done a lot with enabling access to simpler smartphones and simpler tablets that are more affordable. So I would say to people, don't feel you have to have the highest priced and very newest X Phone 15. Let me make that up to get into this. There are ways in which you can get into this, and there are courses that the AARP and others makes available. So your onboarding for this can be simple and affordable.
Ernie?
I would say don't be intimidated by the technology. It's there to make your life better and easier. And frankly, ask your doctor about remote technology, remote monitoring, and telehealth. Again, it's there to protect you and to make your life better and make it easier for you to stay independent longer.
And Grant, you're getting the last word.
Wonderful. And it's to me a bit about what Ernie just said. Don't be afraid of it. And to some degree, so many seniors have become engaged with tele, or now have, at least have heard the word or know people that have engaged with it. And the reality is, many of them engage with it in what really was just, again, sort of a brute force, interaction with a video. The beauty of what these gentlemen are doing and what the space has been doing for 20 years is, they should be thinking about this on an ongoing basis, with companies and organizations that are doing this in a manner in which they back to that seamless digital front door, that easy button to get in, the ability for them to navigate and use their weight scales, their blood pressure cuffs, their other tools that they're thinking to use historically. What they may have experienced in the last 6 months is actually a little more lumpier than what the beauty of this space is today, which is organizations like these two that create smooth, easy access. And so their experience they may have had or heard others having about, I was able to talk to my physician, it was wonderful. No, it is actually a much more elegant infrastructure that will make it easier for them, that whether it's on their smartphone that is easy to use or otherwise, it is a piece of technology that has a service that will be very simple for them to use on an ongoing basis.
So that's wonderful. We think of home as the new health hub, just like it's the new work hub. But great discussion. Fred, over to you.
Well, Mary, we've got more to come, but we just want to say thank you once again to Dr. Taylor, to Grant, and to Ernie for sharing your thoughts with us. Really important stuff, and got a lot to follow going forward. Thank you. So, Mary, it seems like the benefits of telemedicine are pretty clear, especially in the midst of this pandemic. But we wanted to give our listeners and viewers an even better look at what the experience is like. So you've got some people to introduce us to.
Yes, I'm introducing you to two of my friends who are mother and daughter, Pat Stenson and her mom, Jean Stenson, who I've known for a long time. And they're going to talk a little bit about their use of telehealth. And Pat, do you mind sharing your ages too? What age and stage of life are you?
Just like Jack Benny. Okay, I'm 66, and Mom, how old are you?
I am 99.
In fact, Jean, we were just getting ready to celebrate your 100th birthday at the Yacht Club when the COVID started.
It was my 99th
99th birthday, right. Yeah. Well, we'll have to celebrate the 100th next year.
That's right. I'm getting all the candles ready.
Good. Okay. What is your secret to living to be 100?
Social distancing, I think.
Well, that's very good advice.
I know, God is good, I guess, as they say. So,
and I know you've been keeping active with your books, reading books, and listening to the news, and being with your family.
Well, I take a great. I have belonged to a book. Well, I don't know. It's a long story. I've had macular degeneration for 25 years or so, and now I really can't see very well at all. So, but I have belonged to a book club for the last 11 years, and it's very rewarding. The ladies they're all ladies who have raised families and have a certain degree of leisure, but I'm the only one that can't see to read, so they acquire an acoustical book for me, so I can listen to my book, and it's been a very enjoyable experience to be associated with all these ladies who are considerably younger than I am.
and getting to do things together. I know I'm doing an online bridge club, which I enjoyed during COVID time. So Pat, tell us about your experience with telehealth.
I don't know what you want to know. We have been using telehealth, especially in the last 6 months, but before that, we had access to telehealth too. And we have our, we like it in some respects and we don't like it in some respects. You know, it's very convenient if you have something like a medicine change or, you know, just to check in with your doctor. But one visit we had with her doctor, we were on my laptop, and she had some edema in her leg, and he goes, well, can you show that to me? So I'm like trying to maneuver my laptop camera so I can and she had to stand up, you know, so that was kind of awkward. That would have been a much easier visit in person. But generally, I like it because they're usually on schedule when you make an appointment with the telehealth doctor line. They're usually more on schedule. Before, they might call me an hour later and say, oh, sorry, I was with a real patient or, you know, involved with someone who was in the office. And I said, well, they had an appointment. But what do you think, Mom? I mean, it's a lot easier. You don't have to drive and park and, you know, wheel the person in. And go ahead.
For someone who was housebound, basically, it's very convenient, excuse me, to have you consult with the doctor over the phone. But on the other hand, you do sacrifice a certain amount of privacy. You know, the whole world knows what ails you when you're on the phone. But if you can't drive or if you have a problem with transportation, that's very convenient to have that service available to you. And I imagine has come into its own during this COVID social distancing UKs. And I imagine a lot of people have discovered it, didn't know it existed before. And I think it's convenient for the doctors too, to be able to call you somewhat at their leisure, to be able to sit down and talk to you without interruption. You do have a certain amount of time to talk to them and get your business taken care of. So I think it's really very, very convenient. And then you can always, you know, go in if the ailment is serious enough, they'll tell you to come in and see us.
Jean, when you were talking about the privacy aspect, that's because somebody is in the room with you to make sure this is all working, that you don't have a private behind the doors
So
consult.
They know all your ailments.
But on the doctor's end, it is on the doctor's end, it is private. There's nobody else necessarily in the room with the doctor. It's strictly what you're talking about in your home. That you don't have the privacy.
Right. Yeah. I think that's probably the principal drawback, is that you do lose that confidentiality to a degree.
Can you think back, maybe, Pat, what the first time experience was like for you? Were you worried about trying to even get involved with telemedicine?
No, I've used it for my mom and for myself. One thing I miss the face-to-face with the doctor, the actual personal contact with the doctor, even though you're speaking with them. My mom's doctor just retired, and you know, we've been seeing him for years, and he was like a friend too, you know, but I don't think you get that same feeling with a phone call, especially, I don't know what her new doctor's going to be like. We haven't talked to her yet. And so I miss that face-to-face actual reality. And the first time was before COVID, you know, and she also has to take some medication that she needs to be checked on. And so every once in a while her doctor would call and say, okay, you know, this reading was a little high, you know, we need to make an adjustment. And, you know, that's fine. That's perfect for telemedicine, you know, that he didn't have to, you know, do an exam, or she didn't have any, you know, like pain or anything like that. It was just minor tweak to her medication. So I think that's, it's great for that. What else? I had I just developed arthritis in my thumb, so I've had occupational therapy with my therapist on the phone, and I think I'm better doing that in person too, because I feel like I actually will follow through with somebody who's going to see me in real life, sort of like, piano lessons or something. You go once a week, you play on Friday, you go to your lesson on Saturday, right? So I don't know. I may be odd because I just really enjoy that personal experience.
Well, I enjoy the personal experience too. You like to have the doctor know who you are and all your physical attributes in 3 dimensions. but you can always arrange to have an actual appointment to see the doctor. The fact that you use what do you call it?
Telemedicine or telehealth, right?
This service, customary, it's the service covers most of the bases, but it's still desirable, I think, to actually see your physician in person from time to time.
And of course, Pat, you're lucky to be right there with your mom in this time of COVID. Many caregivers are farther away.
Right.
And I guess they would do a telehealth conversation remotely. But it seems to me it might make sense to have a list of questions even before a telehealth consult for your doctor. So I don't know if we need to have a little guide that says, before you see your doctor, be sure to ask these things, so, and of course, the doctor is happy that he doesn't have to commute. At least that's what he told us this morning. And I think you do seem to get one-on-one attention.
Yeah.
I don't know if behavior is going to change that much, because sometimes the doctor gives you advice you don't want to hear, like exercise and eat better. I don't know if people are more inclined to follow up with their doctor. So anything else, Fred, that you want to?
Well, with the whole experience, I'm curious as to whether or not you would be willing to use something like a wearable, an Apple Watch or something like that, or a device like that would let your doctors know what your heart rate is, for instance, things like that they could monitor. I'm not talking about anything intrusive necessarily, but there are some that can even take an electrocardiogram these days that the doctor can see all of that remotely. Would you be skeptical about that or willing to try it?
Talking to you.
Oh, well, I'd be willing to try it. What have I got to lose?
Yeah.
But no, I think those devices are, if they're not already here, they're coming. And well, actually, I can you can get an instrument to take your blood pressure and your whatever,
Well, we have a scale that's Bluetooth to my phone, so we can see what her, weight progress is. And so, there's lots of things besides a wearable that are available to everybody, like the blood pressure cuff and the, but I know a wearable, I don't know, I guess.
Well, it depends on what it looks like, right? If
depends on what?
Like nice earrings, you might wear it, right? But if it's a clunky thing, in Singapore, they just announced that if you wear an Apple Watch, the government will pay you if you walk every day and monitor your health. So it is a balance between having these technology tools that help you monitor your health versus the privacy that you might want to have. And I think those are questions that seniors and all of us are concerned about.
So I guess really a lot of pluses and minuses to this technology, but during this time of the pandemic, I think most of us would say the pluses outweigh the minuses.
I think
Yes,
you're right.
absolutely.
Yeah.
Hey,
I mean, I don't want to take her to the hospital, you know, when anybody there could have COVID, you know, or it seems like so much more effort, you know, right now. So I like her being here and not being exposed. I take a lot of precautions, so I don't want to be responsible for her getting COVID. So we're going to say, Mary?
I was just going to say, Jean's also been with us on a party, and so tell us what you think about having these Zoom conversations.
I don't understand.
She wants to know how you feel about Zoom conversations.
Zoom conversations?
Like this.
Oh, well, I've just been introducing them recently.
She likes FaceTime, even though she can't see the people. She likes to do the FaceTime.
Yeah, I can just barely see you.
Well, we're excited to have you here this morning, and also we applaud your creativity and curiosity and being an adopter with your book club and staying involved. And part of it is just trying something new, right? We're all learning. So
like this.
I'm glad you could be here for our second podcast. So Fred, over to you to close it out. And
well, we really want to thank Pat and Jean for taking the time to be with us and share their experiences. Mary, you know, there are so many places people can turn to online for health information. And I know you have a few favorites, but you mentioned, I think, Harvard Health.
Right. There's the Harvard University updates every 2 weeks their medical research, and so it's very easy to get updated information. And then we have some books in our bookstores. I frequently go to the independent bookstore to just see what boomers and seniors are reading, and there's a lot of interest in the body right now. There's a lot of interest in immunity. There's an interest in, you know, you mentioned blue ocean zones. So we hope to do a show where we can feature some of these innovations around health and wellness, because home is the new health hub. And it's the new work hub, it's the new entertainment hub. And so we should learn a little bit more about staying healthy, eating healthy, and being engaged with others. So. And
that's the primary focus of the podcast going forward, is the intersection of technology and longevity and aging. So we hope people will stay with us. And you have resources as well, Mary, at maryfurlong.com. It's where you can find us. You can also find us pretty much everywhere you get your podcasts, on YouTube, and you can also ask your smart speaker to play us. Just say, Alexa, play the Living Longer, Better, Smarter podcast, and it will work. We want to...
We're so excited to be with all of you and to grow this community of people who are interested in these issues. And what better guest than someone who's 99 and a half telling us how to live longer and better. So thank you all. Okay.
We want to thank our sponsor for this episode, Vital Tech, providing digital solutions, transforming connected health. For more information, the website is vitaltech.com. And thank you for spending some time with us. Stay healthy. And Mary, you've got a couple of reminders?
2 reminders. Actually, we should have Jean remind us. Here, 2 reminders. Let me remind you to register to vote, and then subscribe to Living Longer, Better, Smarter, and tell your friends and suggest ideas to us as well. Thank you, Fred. It's been fun to be with you.
Terrific, Mary. Thanks.